Welcome today in the JQSH authors section. We are extremely fortunate to have Dr. Paulo Borem with us. Dr. Paulo Borem needs no introduction. He's a senior director at IHI and has an impressive track record of over 15 large-scale healthcare initiatives across Brazil, Portugal, and Africa. Today, we're going to talk to Dr. Paulo Borem about his groundbreaking study that is published in the February issue of JQSH. And that study applies the training within industry, the TWI concept, specifically the job instruction, JI, into a large scale quality improvement project in Brazil. So, welcome, Dr. Borem. Dr. Borem, can you please shed some light on the TWI concept itself and what inspired you to choose this methodology for your study?
Well, thank you for your question, Shaikh. So, training within industry, or TWI, it's a program developed during the World War II to quickly and effectively train workers in essential skills. It has three components: job methods, job relations, and job instruction, which we will focus on today. So let's talk a little bit about job instruction. Job instruction is an effective and efficient way to train someone to perform or a process or a procedure correctly, safely, consistently, and consciously every time. For me, this is the best description of a standard work. So although IJ was not originally designed for training healthcare workers, it seems to me to be one of the most desired methods. We should not learn by making mistakes on patients. For instance, Toyota trained all its employees using TWI to produce the perfect car. It is absurd to me that we don't use to train healthcare workers to deliver perfect care for each patient. So TWI, in my opinion, especially JI, it's a powerful tool for continuous improvement and staff development. And you asking me what inspired us to do this, to adopt TWI? Well, during the initial phase of a large-scale collaborative effort to reduce hospital-acquired infections in 116 public ICUs in Brazil, we used checklists to control the quality of care process, specifically for bundle reliability. However, this checklist proved to be inefficient, bureaucratic, and disconnected for the actual care process. So our goal was to find a more effective method to ensure adherence to care bundles that were integrated to the care process. So that's why we decided to study and implement TWI in these large-scale collaboratives.
If I ask you, what are the specific aspects of this job training, job instruction training that contributed most to the impressive outcomes that you have?
Yeah, job instruction create the standard process. So since JI, let's call it JI, provides a clear step-by-step method for performing tasks, it standardizes all the procedures, especially manual tasks. This hands-on, one-on-one training with simulation was crucial in this initiative. Unlike traditional theoretical instruction, JI emphasized practical skills, simulation, and real-time feedback to the healthcare workers, leading to better retention and application of the knowledge. So this hands-on training combined with visual management create a system to continuously improve the quality of care. So that's why I think IHI is so important for the healthcare system.
Great. And also your paper talks about the visual management, like Kamishibai cards and other tools. So what do you think about the integration of the JI with these visual management tools and how much they help you in ensuring that these improvements are maintained after the initial implementation?
Great question. So visual management tools like commission by board in cards provide a visible and immediate way to control process reliability because everybody's going to look at the cards, red or green, and say, oh, the process is reliable or not. So these tools, they allowed for quick identification and correction of deviations, ensuring consistent adherence to standards. Not adherence, red card, green card, the process is fine. So everybody looks at the board and see what's going on in that unit.
In this study, how did you foster communication other than visual management? Like, how did you foster teamwork and engagement, and how much the GI contributed to the overall success of this project?
Yeah, it's interesting because JI training fostered in fosters a shared understanding of the procedures, and this is very important. Teams now alternate roles, with one healthcare professional performing a procedure while being observed by a peer using the bundle element certification sheet. Next time, they switch roles. So this approach ensures they fully understand the procedure, including all its important steps, the key points, and the reasons for the key points. This is a quality control during operation as described by Juran. So that's why JI helps the communication because everybody is in the same page now.
Great. Dr. Borem, can you, I mean, what do you think about this successful project? Is it applicable or can be done in other low resource setting countries? And do you think that if it is adopted in some of the other countries, what modifications they need to do in this project, or they can just adopt it as it is and be successful like you?
Yeah, sure. The core principles of JI, such as standardization and hands-on training, are applicable across different contexts, and they are not costly. While some hospitals might not have access to simulation labs, they are not essential. The most important steps are to create the job breakdown sheet, adopt the 4 steps of the method, and train one-on-one until you are confident that the trainee has mastered the procedure. So it's a low-cost method and very effective.
What do you think about the leaders that were involved at different levels in this project, and how did how did it influence the adoption and sustainability of the GI practices?
I will start with a leader that we had this very close relationship with him. And one day he called me and he said, Dr. Borem, now I know what's going on in my ICU because I walked in the ICU and I saw the commission by board and I saw a lot of red cards and I said, wow, we need to do something better here. And he immediately got involved in the improvement initiatives with the ICU. So, but not just the senior leader. All leaders at all levels are crucial. So in this case, IHI trained the trainers who then train local leaders, creating a system that built capability across all leadership levels from the start of the initiative. Now, each ICU not only has an instructor in JI, but also a team that has mastered and excels in the performance of each element of the bundles.
Yep. So my next question to you would be about the challenges. I know that you have huge success, but we all
Of
know that
course.
every success comes with the challenge. So what were the biggest
Mhm.
challenges that you faced during that study? And could you tell us what are the lessons you learned that can help other organizations to implement similar QI initiatives?
Yeah, that's a great question, and I have so much to talk about it. But let's start with the big challenge. And the first one was resistance. It's a new method, and they did not understand at first. So, and they needed the discipline to adhere to apply the new method. So, in one shared concern was how the hospital trained hundreds of frontline teams on a one-on-one basis. That was a big concern. So the answer is fine. You don't need to train everybody in the same year. You make a plan and you train all the frontline teams. So this process might take longer, and and but at the end, the hospital is going to have skilled professionals, and also is going to save a lot of lives, time, and scarce financial resources. We could also demonstrate its effectiveness during the implementation of the bundles after a rapid test of using pediatric cycles. Another key lesson was to create job breakdown sheets, starting with the crucial or critical elements of the bundle to avoid overwhelming the teams.
It seems like you have good knowledge of all the challenge that you face, and you really rounded up pretty well. What do you see? How does it go from here? I mean, what are the next steps for this research, and where do you want to take it further? And scaling this approach to like other healthcare system.
So the next step also should be investigating these organizations that adopted the methods, using specific assessment tools to understand how easy this method is from the frontline perspective. So I'd love to study this. Now we have around 300 ICUs that are using this method.
Did you have any unexpected positive outcomes from this initiative that were not thought out before the study?
Well, one unexpected positive outcomes included the increased staff engagement, better teamwork, and in a proactive approach to quality improvement. Because quality is not, let's say, responsibility of a department. Quality improvement is responsibility especially for a responsibility of the frontline team. And so this method really engaged them in believe that they could do better. So, of course, the bundle reliability increased from 80 to 95% for all the infections, and the infection rate dropped more than 50%. And I'm very happy to say that over 7,000 infections were prevented, creating a more resilient system where frontline teams can thrive. And this is also a very unexpected result of this methodology.
Really, thank you for your time today. We're really honored to have you with us, and I am really thankful that you shared all this knowledge with us. Thank you very much.
Thank you. So please read the manuscript, and there's a lot there to learn. Thank you, Shaikh.